Hello and welcome to the enrollment guideline for how to enroll on the healthcare.gov marketplace, as brought to you by InsureCare. Okay, first what we're going to do is click Apply Now, the green right in the middle of the screen, and then we're going to get to the next page and welcome to the marketplace, and you will choose your state from a drop-down menu. I'm going to select Indiana because right now that's where InsureCare is at. I'm going to click Apply. It says Let's Get Started. I'm going to go ahead and click that. And now I need to create a marketplace account. I'm going to go ahead and use my name for this example. And I'm going to go ahead and fill in the email address as well. That'll be necessary later if you need to get emails or e-sign documents and things of that nature on the marketplace. Now, you'll get a confirmation email sent back to you. You'll need to go and right-click that in order to activate your marketplace account. Again, the email I used, you can tell I've already verified this email, was info@insurecare.com. And you'll go ahead and log in now with your username and password in order with that you just set up in order to get into the system. You'll go ahead and log in with the username and password that you just set up. Now it says Indiana applications for individuals and family. You may need the following information such as birth date, social security numbers, etc. Click Next. It's not that hard of a task. It's self-explanatory. The system does have some glitches, as you'll see momentarily. Again, it's showing you more of what you might need. Social security information and etc. Okay, it has a privacy policy that you need to agree to the terms and conditions. And now it's pulled up my information first. Okay, I'm going to put a fictitious date of birth in there because we're not actually going to submit this application. But you'll want to put your actual information. And we're just going to create a street name. 123 Anytown Street should suffice. I'm going to make this for Indiana. So we'll use Jeffersonville, Indiana. Now later on in this video we're going to get into the types of plans you can sign up for as well. I'm going to go ahead and list the InsureCare phone number. If you don't have it, you might want to write it down. It's 855-853-6944. And we'll be more than happy to assist you with your enrollment on the telephone if you need so. Okay. And it's okay to email me here at info@insurecare.com. We're going to re-enter that. Okay. Save and continue. And it does sometimes take the next screen a while to load. These are linked with the Federal Data Hub, the information that you provide, and they match your name and date of birth and social with what they have on your tax records and incarceration records and things of that nature. Okay, it's not gonna recognize it. It's as an address, but I'm gonna go ahead and select continue anyway, since this is a trial application for us to experiment with here. Okay, help applying for coverage. Tell us if you're getting help. You are. It's an agent and broker from InsureCare. And again, my name is Joseph Shope, S-H-O-P-E. Okay, and it's going to want an NPN number, and that number is 163-44359. And then the FFM user ID, if you'll just type in InsureCare. InsureCare.com, the agency that cares. Okay, and if select save and continue on that form. Okay, help applying for coverage. All right, questions. This is security questions. It's going to ask you to pick from one of those drop-down menu choices and create your secret answer to your security question. Who are you applying for health care coverage for? Myself only, myself and family, or only my family. Select and hit save. Okay, now it says, do you want to find out if you can get help paying for your health care coverage? You would select yes. If you make a great amount of money, you might want to select no, and then you would hit save and continue. Okay, here you're going to want to bump it up to the members in your household. I have a household of 4, so I'm going to select next. This can create issues later, as you'll see on this demonstration. Okay, it's going to default to my information, which is already input into the system. Okay, I'm going to click Save and Continue. Now it's going to ask for my first person. I'm going to start with my wife, and I'm going to title that Wife Shope. Okay, and I'm going to give her a fictitious date of birth here. We're a couple from the 1950s. So, okay, not quite Medicare age. Let's see, that's my spouse. And now I'm going to go to the next person, which will be my oldest child. I'm going to call this Dr. Shope. And I'm going to give this child a date of birth and the relationship to me. I'm going to go over to the drop down box and we'll select son daughter and save and continue. And you'll do this for each member of your household that you have, whether it's 2 or 6 or 10. The next I'm going to go to son Shope with a fictitious date of birth. Okay, and relationship to Joseph Shope, again, will be son-daughter, and save and continue. Now, this is a summary review. You're just going to glance down through there and make sure the names and the date of births add up in the relationships. You can click Edit if any of them don't, then save and continue. Next, it's telling you you might need to add Social Security numbers. I'm not going to do this for here. Okay, is the sex correct? Yes. Okay, save and continue. Okay, it's going to ask me for social. It says optional, so I'm not going to put one in there. I would just make one up. But we'll just leave it blank since it's optional. You'll need to input your actual data. Again, this links with the Federal Data Hub and your taxes. Okay. My information and my taxes. Am I going to have a return? Yes. Does Joseph Shope plan to file a joint return? Yes. Will Joseph Shope and Joseph Shope's spouse claim any dependents? Yes. Which dependents will you claim? Joseph Shope and Joseph Shope's spouse. See? So I want to select all of them but the actual spouse because that would have added her on there yet again. As you'll see, this system has kind of got a few bugs in it. But we can muster through it together. It's not that big of a deal. Okay, please wait as it's loading. Okay, does Joseph Shope live with 1 or more children under age 19? And this is confusing. It says optional. Well, yes, I've already listed my children. I'm going to select yes. It wants you to list them again. So, wait a minute. So I've already done this, and that what this does is it regenerates them again onto the system when you do this process. So I would recommend if you selected 4 at the beginning, you might want to select no here because you'll see this is what I did. I went ahead and put daughter Shope again. Added the fictitious date of birth. Okay, and we're Joseph Shope's row. This time it works it backwards. I had to select parent. Add the second child. Son Shope. The date of birth. And I had to select myself as the parent. So it works it in reversed order on the relationship. Save continue. Joseph Shope's race, ethnicity. I would have thought this would be kind of inappropriate. So I'm not Hispanic, so I'll select no. It's asking you, you can select more than one on your race. So we're Native American and white or Caucasian. Nobody says Caucasian anymore. So I'm going to select that, but you can select whatever you are, Japanese or Native or African American or what have you. Okay, wife's Shope's information. What's her sex? Female. Wife Shope's information. Okay, enter wife Shope's Social Security. It was optional. Wife Shope's a U.S. citizen? Yes. Save and continue. Wife Shope's home address, is that correct? Yes. 123 Anytown Street. Save and continue. Okay, does wife Shope live with one or more children under the age of 19? And here is the issue again. We'll select yes. Well, now you have to list them again. And say that she is the parent. So I'm going to try to select save and continue, and it's going to tell me that there's an error. So I have to relist these people yet again. Okay, daughter Shope. And the fictitious date of birth. And relationship is parent. Okay, and the next child, son Shope. Date of birth and relationship is parent. Now this wouldn't be quite so bad if it doesn't ask you for financial information on every single person. And now it looks like I have a family and went from 4 to 8, I believe. So, okay, again, not Hispanic. Select the origins, races, etc. Daughter Shope's information. What is her sex? Female. Daughter Shope's social. You just hit save and continue. I would recommend inserting that information, as it may save later having to revisit everything again. As you are doing this yourself, you're in a secure federal hub. You're not giving it to a third party, and I'm the agent assisting you, and I have absolutely no idea your personal HIPAA-related information. So that's a good way of doing this way. And again, we appreciate you viewing this tutorial. Okay, what's daughter Shope's address? So this is just a little bit of busy work. We have to tell them again and again. Okay, daughter Shope is to the wife as a daughter, son. Let's see. No. Does daughter Shope live with one or more children? At this time she has none. We'll select no. Save and continue. So it wants to see if since she lives with me, if anybody lives with her. Okay, let's see. Daughter Shope's race, ethnicity. We're going to select no Spanish. Again, Native American, white, American Indian. Okay, the son Shope's information. Again, it's going to ask for his social because I didn't give it to him earlier. Just click save and continue for this demonstration purposes. Okay, is he a citizen? Yes. What's son Shope's home address? 123 Anytown Street. Okay, son Shope's relationship to wife Shope. There we go. Is he married? No. Does he live with any children that are his? No. Oh, didn't we do this already? Son Shope's race, ethnicity information. Non-Spanish. American Indian. White. Save and continue. Daughter Shope's information. What is daughter Shope's sex? See, I thought we already did this. So if this happens to you, just keep entering it and it will eventually move forward. It did with me. It did the same thing on the income section, which will be in a moment. You have to tell it the same thing a couple of times. Do you want to provide the social? No. You said it was optional earlier. We skipped it. So I would recommend just going ahead and giving it to them because that's really what they're wanting here. And it's going to be part of your taxes. But since this is a demonstration, again, I'm selecting no. What's daughter Shope's home address? Okay, son Shope's information. Again, it's asking me for his sex, and it will, this time it will ask me if I really want to provide a social security number. It's like, are you sure? No, I do not want to give you the social. Okay, what is son Shope's home address? Again. Okay, what is daughter Shope's sex, male or female? And I'm looking going, is this right? Because we've done all this already once or twice. Okay, is this her correct address? Yes. Okay. Oh, we're back to son Shope's information. And it's almost done. What's son Shope's sex? It's male. Save and continue. Do you want to provide his social security number? No. Save and continue. Okay. And this is his home address, 123 Anytown Street. More about this household. Now we're on other information at this time. Okay. Do any of these people below have a physical disability or mental condition? Nobody. Do any of these people need help with the ADLs, activities of daily living? No. Or do they live in a nursing home or medical facility? Select save and continue. Are any of these people American Indian or Alaskan Native? I selected yes, these four, as we are part. I love how if you're Native American, they want you to prove it with tribal membership. Are any of these people, okay, in foster care? Were any of these people in foster care? No. All right, summary. So we're going to look at all the information we've input so far on everybody. We're just going to scroll down through here and see if anything jumps out at us as being incorrect. Daughter Shope, son Shope. Oh, another daughter Shope, another son Shope, another daughter Shope. Okay. All right, this is the 2013 Federal Poverty Guideline. Is if you'll notice here off to the side, you'll see the household size, 1, 2, 3, 4, 5, 6, 7, or 8 people in a household, and you select the approximate dollar amount that you made last year. And what you'll do is that'll show you the percentage up above to see if you qualify for any financial assistance such as subsidy levels. There are subsidy levels and there are tax breaks that you'll get at the end of the year. Cost sharing reductions. In order to be eligible for cost sharing reductions and to receive eligibility criteria for a premium tax credit, you must be at or below 250% of the federal poverty level and be enrolled in a silver level healthcare plan, which basically pays 70% of your healthcare needs. A little more pricey, but you can get some of your cost sharing reduced. Okay, eligibility for premium tax credit is based on the household income and access to minimum essential coverage. The following summarizes key eligibility standards. You must not be eligible for minimum essential coverage, including employer-sponsored coverage, Medicaid, CHIP, Medicare, or other forms of coverage. You must have an annual household income that is between 100 and 400% of the federal poverty level. You must be part of a tax household that will file a return for the coverage year. Let's see, and you must be eligible for coverage in a qualified health plan. Okay, next we're moving on to income. Okay, you may need your pay stubs, W-2, and other information in order to fill out this section. Does Joseph Shope have any of the following income? Yes, and I'm going to select a drop down, and I have a job, sell insurance, name of employer. You'll want to fill out this information here. Okay, I'm going to put InsureCare. All right, and how much? I'm very underpaid. I'm putting in $27,000 for my family of 4, and that's annually because they pay us quite disjointed. Click Save. All right. Now, does Joseph Shope pay for any of the following deductions? Okay. Student loans, alimony, or other. No. Because right now my loans are in hiatus until I can generate enough income. So I volunteer for products such as this video. Okay, so we'll go ahead and select no here. Save and continue. Is any of this income from these sources? Let's see. Per capita payments, royalties, farming, ranching. Yeah, I don't think so. Okay, we're going to select no and then save and continue. Okay, based on what you told us, if Joseph Shope's income is already month to month, then it's about $27,000 a year. Yeah, is that about right? Yep. Save and continue. Okay, that means your monthly income is about $2,250. Does that sound correct? Yes, save and continue. Does wife Shope have any of the following income? Yes, she has a little part-time job. in addition to being a homemaker. Okay, she is a clerk. We'll type in clerk, part-time. Okay, the amount that she makes, we'll put this one a weekly salary. She makes 150 to 200 bucks. We'll put in 200. Oh, whoops, a week. Click save. Okay. Will wife show pay for any of the following deductions? We'll say no. She has student loans, but she can't afford to pay them either because our economy is in the... Never mind. Save and continue. Okay. Okay. Is any of this income from any of these sources? She's not a rancher. Natural resources, royalties. No. Moving on. Okay, based on what you told us, she makes maybe $10,000 a year. Does that sound about correct? How much she'll make in 2014? Yeah, that's about right. Save and continue. Her monthly income is about $866. That sounds almost a bit much, but we'll say yes and save and continue. Okay, does daughter Shope have any of the following income? Not currently, no. Save and continue. My family's actually a little bit younger than that. They're all still in school. Okay. Will daughter show pay for any of the following deductions? No. Is the income from any of these sources? Well, I told him she had zero, so it's don't know why it's asking me this. So, does any of her $0 income come from natural resources, royalties? No. Save and continue. Okay, based on what you told us, if daughter Shope's income is a steady month to month, then it's about $0. Is that right? Yes. She makes $0. Save and continue. If you'll notice off to the side, you'll see daughter Shope, son Shope, daughter Shope, son Shope, daughter son and Shope, son Shope on there for that many times. And yes, I will have to redo that and do this over and over again. So what we're going to do is we're going to skip through this section here where I have to answer the questions the next 4 times over. And then we're going to move on to the next section, which is additional information. So I'm going to fast forward this video so you don't have to sit through this, but you will need to do this on the healthcare exchange if you had selected the buttons like I did. Okay, we're now to the section that has an income summary. So we're just going to scroll down through there. It should probably let me delete some of these extra people, and it won't. So we'll just click next. Okay, now it says information that you may need here. Okay, about your health coverage. Go ahead and select next. Are any of these people a member of a federally recognized Indian tribe? No, they are, but they're not on the register rolls. So I'm going to select no for now. Hopefully adjust that later and get some free college maybe. Okay, providing a Social Security number may help us to get a better idea of how much extra help you can get in paying for your health care coverage. I'm going to go ahead and select no at this time. Again, I would recommend that you did put that on there. If I were applying for actual coverage, I would have listed the Social Security numbers of each member of my family. And I'm going to click Save and Continue. Okay, next it's time to review and sign here. Okay, if everything looks correct, we're going to scroll down through there. Okay, we click Save and Continue. It all looks correct to me. They actually only had 4 family members at the very top of this. Okay, read these statements and select whether you would agree or disagree. No one applying for health coverage in this application is incarcerated. I agree. Make an eligibility determination. Let's see. I agree to allow the marketplace to use income data. I agree. I know that I must tell the program I'll be enrolled in information if I listed on the application changes. I understand that any changes is my responsibility. Could affect my eligibility. I agree. Save and continue. Now you're going to have to sign and submit. Read the statement and check whether you agree. Okay, I'm signing the application, under penalty of perjury, etc. Now you know that I didn't list correct information on here for the purpose of this demonstration to you. So I'm going to ask that you go ahead and select I agree and type your name in there. That will count as your electronic signature. I'm going to have to click cancel. You would be redirected to the correct screen in order to view the plans. Actuary value. Basically, there are 5 levels of actuary value. Catastrophic we'll discuss here in just a moment. The bronze is a 60% copay. The plan will pick up 60% of your healthcare cost. The silver is a 70%, the gold is an 80%, and the platinum is a 90%. However, the higher that you go as far as what the plan will cover, the more your out-of-pocket costs are going to be with premium. So basically, if you know you're going to be needing a lot of health care, you might want to go with a platinum plan. This is kind of like getting a Medicare Plan F for, you want most everything paid for with very, very little out of pocket on your personal cost, then you'll go platinum. If you're like most Americans, you'll want the lowest premium. You need this coverage for an emergency. So you'll want to go with bronze. So the average plans seem to be bronze, silver, and gold for most folks, and bronze and silver being the 2 most prevalent for folks on the marketplace. But the bronze pays a 60%, and the silver pay a 70%. I'm going to go ahead and show you a version of the plans here. For starters, we're going to talk about the types of plans that you're going to see. HMOs and EPOs may limit coverage to providers inside their networks. A network is a list of doctors, hospitals, and other healthcare providers that provide medical care to members of a specific health plan. If you use a doctor or facility that isn't in the HMO's network, you may have to pay the full cost of the services provided. So that's the big thing with HMOs and EPOs. If you step out of the network, you're liable for the entire bill. So if you can navigate the network, your cost and expenses are less than if you have a plan that has in and out of network coverage. Now, those are PPOs and point of service plans. Okay, it says here on the network plans, if you have a point of service plan, you can visit any in-network provider without a referral, but you'll need a referral to visit a provider that is out of the network. Okay, it also mentions here high deductible health plans. You can feel free to read over this. We have another screen that we're going to share, the catastrophic health plans. Again, that was an option that you have on the exchange instead of a metallic tier, and that's for folks that are age 30 and under. who would otherwise not have health coverage. It says a catastrophic health insurance plan covers essential health benefits but has a very high deductible. This means it provides a kind of safety net coverage in case you have an accident or serious illness. Catastrophic plans usually do not provide coverage for services like prescription drugs or shots. Premiums for catastrophic plans may be lower than traditional health insurance plans, but deductibles are usually much higher. This means you must pay thousands of dollars out of pocket before full coverage kicks in. That would not be recommended for the majority of folks. In order to really to consider getting a catastrophic health plan, you must really have no other option. As a general rule, we would point folks towards the bronze. So only you know your specific healthcare needs in a plan. We recommend that if you have any other questions, you can go on to healthcare.gov and to review that information. Now we're going to pull up some examples of the plans that you're going to see. You'll see here I have a slightly different system. Yours will automatically be limited to your plans that are in your state. So it's gonna these plans are statewide. Okay, so you're gonna see the plans that are available to you in your service area and the companies that are available that have these available. In this system here, I'm going to type in Texas because Texas, I'm licensed in all 50 states. Let's see, and you can even select the county by typing that in here. So now I have the plans that are available in Parker County, Texas, and I'm going to scroll down through here. You can see that there are the metal levels off to the side. If I move over further, you'll be able to see if they're HMOs and PPOs and what the carrier's name are. So you know that if you need in and out of network coverage, but you don't have very much to spend, you might want to go with a bronze PPO. If you need the in and out of network coverage, you would go with a bronze PPO. You would pay just a little bit more for that premium. You might want to consider if you're sitting a little bit better, you'll step up to a silver that'll pay 70% of your healthcare needs. You would be liable for 30%. And there is HMOs and PPOs in that category as well, on up to platinum. So you're going to basically be able to see how much your premium would be on the plan. And of course, we've entered your information, so if you qualify for the governmental subsidies, the system will already flag that. With the Obamacare, it's popped up some new health carriers, some of which I've not been familiar with. I've been in the business for several years now in all 50 states, so you'll see some brand new names out there. However, there are some very familiars. With the new laws and regulations, what's happened is not all of the familiar names will be in every single market. I can tell you that some big names like Aetna are going to be on there, most likely in your market. And Humana is also available on the exchange. Humana has plans that actually cater to veterans. That's their mission in life. So Aetna, Humana, Anthem has plans in many states. I know Anthem of Indiana, Ohio, Missouri, and Wisconsin are pretty prevalent in those areas. Okay, again, I would like to thank you on behalf of myself and my family for listing my name and my NPN number on your application. Again, that number is 163-44359. That's my national producer number as a licensed insurance broker. Okay. Again, if you want to visit and review some additional information, you can see this video and more on ensurecare.com. We're on YouTube as well under ensurecare.com. And You can feel free to call us as well. We've been quite busy this time of year, but you can reach us at 855-853-6944. Again, thank you for joining us today on this instructional video, and we wish you the best and for you and your family, and hope you have a successful venture on the Federal Marketplace Exchange, and hopefully you remain safe and healthy for the upcoming year. Thanks. God bless.